2, 3, 4.
1, 0, and liftoff.
What happens to astronauts when they go into outer space with no gravitational effects? Why do bedridden patients feel faint when they get up? Why do people on antihypertensives feel faint when they get off the bed quickly? This experiment will show you what happens to blood pressure in the arteries, veins, and the heart due to the effects of gravity, and how you compensate for these effects when you change posture. The purpose of this experiment is to measure the effect of changing posture on blood pressure, pulse pressure, and heart rate in an anesthetized rat. This gives us an opportunity to directly visualize what happens to us when we get up from lying down or when we do a headstand. Indeed, the blood, being fluid, will be affected by gravity. So how does the body compensate to changes in blood volume, pressure, and flow when we alter our posture? Let us see what happens in an anesthetized rat and try to explain how such changes are brought about. To begin the experiment, Dr. Lee sets up the equipment. This is the source of light. This is the most important equipment, as the blood vessels of the rat are very small, making it difficult to cannulate. A magnifying glass is often needed to see the vessels better before they are cannulated. Oxygen and the anesthesia is administered to the rat through a breathing tube. These are the tiny but highly sensitive pressure transducers that will be put through the blood vessel to measure the blood pressure and heart rate. The tip of the transducer senses the pressure. The transducers are connected to a recording device. The rate of movement of the recording screen and the amplitude of movement can be adjusted using these controls. Now that you are familiar with the equipment, let us begin. The anesthetized rat is secured, and after locating the femoral artery in the leg, a small nick is made on the skin of the upper thigh. Note the artery flanked by the femoral nerve and vein on either side. You can distinguish the artery by its rounded appearance due to its thicker walls, its reddish color because it carries oxygenated blood, and its pulsations. The vein is purplish in color and does not pulsate. The walls are thin and they collapse easily. The femoral artery is then cannulated and the recording device adjusted for amplitude. This will indicate pressure in the lower limb. Similarly, the carotid artery is cannulated and the transducer pushed into the left ventricle. This will measure pressure in the upper part of the body. After getting a steady measure of pressure, the rat is tilted with the tail end lower than the head. What do you see? What happened to the diastolic and systolic pressure in the femoral artery? Has the pressure in the femoral artery increased or decreased? Now look at the pressure in the left ventricle. What do you see? Yes, the pressure has decreased. What has happened to the heart rate? This was the rate before tilting. And this is what happened as soon as we tilted the rat. Watch what happens as we continue to keep the rat in this position. What happens to the blood pressure in the femoral artery, in the left ventricle? What happens to the heart rate? When the rat is tilted up, the blood pools in the lower leg area due to the effect of gravity, and the pressure decreases in the head region. The decrease in pressure is detected by the baroreceptors located in the carotid artery and aortic arch. They communicate these changes to the brain and bring about a reflex increase in heart rate and blood pressure via the sympathetic nervous system to ensure adequate blood flow to the brain. This is what happens when we get up from lying down. But if a patient is on antihypertensives that block the alpha-1 receptors, the blood vessels do not respond adequately to sympathetic stimulation. the vessels do not constrict to reflexively increase the blood pressure. Blood flow to the brain is therefore reduced, and the person feels faint. Now let us tilt the rat so that its head end is down. What changes do you see in the left ventricular pressure? What is happening to the femoral pressure? What is happening to the heart rate? Watch what happens as we continue to keep the rat in this position. What is happening to the blood pressure in the femoral artery? In the left ventricle? What is happening to the heart rate? If we quickly turn the rat to an upright position with the tail end lower, what do you expect to see? Let us see what happens. Does the blood pressure and heart rate take a longer or shorter time to recover to its original rate? So what happens when you remove the effect of gravity, as in a spaceflight? Venous return and the cardiac output is increased, as there is no pooling in the legs. The baroreceptors react as they would when blood pressure is increased. There would be a drop in blood pressure. The body will try to reduce the blood volume and thereby decrease pressure by forming more urine. There will be an increased secretion of atrial natriuretic peptide from the atrium and decreased secretion of antidiuretic hormone from the posterior pituitary. Aldosterone secretion from the adrenal cortex would decrease. Due to increased renal perfusion, renin secretion is decreased, with resultant decreased angiotensin II levels. All these mechanisms together will result in increased urine formation and reduced blood volume. Now, what will happen when the astronaut returns home? Can you explain